Welcome to Mom Matters. I'm your host, Alyssa Dver. In the next 10 easy-to-watch minutes, we're going to give you practical tips for more productive parenting. We're talking today with Dr. Lynn Levitsky about childhood diabetes, a very serious thing that is reaching, as I understand, epidemic proportions in at least the United States. And we're going to talk today with the doctor about this particular disease and what we can do as parents to prevent it. Dr. Levitsky is the chief of pediatric endocrine unit at the Mass General Hospital for Children. She's also on the editorial board of the Journal of Clinical Endocrinology and Metabolism, and she's the past president of the Pediatric Endocrine Society. So we are very grateful for you to join us today.
Thank you very much for inviting me.
Let's start with the basic question about what is diabetes? What is the disease all about?
Okay, so diabetes is usually recognized because the levels of sugar in the blood are too high. But they get to be too high basically for one of two reasons. One is that the very important hormone insulin, which is made by special parts of the pancreas, is not produced in large enough amounts, and insulin is very important for getting sugar into cells and for allowing the cells to use sugar. Okay. So if there's not enough of this in the blood, then someone's sugar in the blood increases because the sugar cannot be used by the body. The other reason why people get diabetes is because although there's plenty of insulin in the blood, the body is very resistant to the action of the insulin. And so even though circulating levels of insulin are high, the body doesn't respond to it appropriately, and basically you end up with the same effect, which is high levels of sugar in the blood and inability of the body to use that sugar and to use other things that are used for energy like proteins and fats appropriately, because insulin is necessary for all of those normal things that we take in as food to be used as energy and used as building blocks, which is very important in children because not only do they maintain their weight, but they increase their weight and they grow.
So what is a symptom of somebody who has diabetes, for example?
The usual symptoms early on are related to the fact that you have large amounts of sugar in your blood and the body gets rid of that sugar in the urine. So you end up being very thirsty and you end up going to the bathroom a lot. You have to urinate frequently. In children, sometimes it shows up when a child who's been previously toilet trained starts wetting the bed. There are lots of other reasons why someone might drink a lot and go to the bathroom and urinate a lot, but this is one of the major ones, which is a disease, and any parent who has a child who starts asking for water all the time and going to the bathroom a lot, you really have to consider this, and you should call your doctor and arrange for this to be tested.
Okay, now I know that there's different types of diabetes. Are they this, first if you can describe the types, and then are they different between children, adolescents, and adults?
Yeah, there are two major types. There are some very rare ones too, but the two major types are described as type 1 diabetes and type 2 diabetes, and when we think about it, we usually think about type 1 diabetes almost always occurring in children, and type 2 diabetes always occurring in adults, but this isn't quite true. Type 1 diabetes is the kind where your body cannot make enough insulin anymore. Okay. It's an autoimmune condition, it's immunologic, and when you get this, gradually the pancreatic islets, which are the little organs in the pancreas which make insulin, stop being productive and start getting destroyed. If you have this kind, you have very severe diabetes. Not only can your sugar get out of control, but you can also break down your fat and get acidotic, which means you get acid in your blood because you're breaking down your fat into ketones. And you can present very, very sick unless the early symptoms are recognized. This can be seen even in elderly adults, but is more common in children. Type 2 diabetes is the kind that we associate with overweight, with obesity in adults, so that you become resistant to insulin. But we are seeing type 2 diabetes even in children today, seen in children even down to the age of 6 or 8 years, although it's more common in adolescents, and it is associated with our obesity epidemic.
One quick question before we go to break. Are the standard blood tests that they do upon annual exam of your children, do they test for diabetes?
Very rarely, because usually they're just doing a lead test or checking a blood count. So you really have to, parents have to be alert to the symptoms.
Excellent, and that's a perfect place for us to break, because when we come back, I want to talk about, as parents, what can we do to prevent onset of, say, type 2 diabetes in our children. We'll be right back.
Does your child have food allergies, celiac disease, asthma, diabetes, or other health concerns? One of the most important things you can do is to make those around them aware of their needs. This is especially true for children too young to explain it themselves. Stat Kids products were designed by a mother who struggled to manage her young son's food allergies and found no practical age-appropriate allergy-specific products to help. From bright red silicone wristbands and lunch bags that provide a bold health alert, to travel packs and emergency cards that keep medication and emergency information accessible, the Stat Kids line provides the tools you need to identify and protect your child. Select items from the Stat Kids line are available at Amazon.com and BabiesRUs.com. To see the entire product line, please visit www.statkids.com.
Welcome back to Mom Matters. We're talking here with Dr. Lynn Levitsky about childhood diabetes. What can we do as parents, or can we do anything to prevent it happening in our children?
Okay, so type 1 diabetes, although it is increasing in frequency, and when children graduate from high school right now, somewhere between 1 in 500 and 1 in 600 children in the United States have type 1 diabetes. Nonetheless, there doesn't seem to be anything we can do to prevent it. We can only be aware that it might happen. Hopefully someday we'll know how to prevent it, but we don't yet. Okay. Type 2 diabetes is directly related to obesity, to our tremendous obesity epidemic, and every parent has the ability to control that. You can get the soda and the juice out of your house. It's just water, candy, that's all it is. Juice and soda, it doesn't matter whether it comes with nice labels on it. That's all it is. It's candy, and the kids should not be having it anytime, ever. Okay? You can reduce the amount of food, you can get all your children exercising, and you can listen to your doctor about your child's weight and maintain that appropriately, and your child should not get type 2 diabetes in childhood.
What are the treatments once you know that your child does have diabetes? What's the impact on that?
Yes, so type 2 diabetes can often be treated with oral medication. There's one good oral medication that's approved in children, and there are some others that aren't approved, but doctors sometimes use, that are used in adults. Type 1 diabetes must be treated with insulin injections, or an insulin pump, which gives a sort of continuous injection of insulin. Children with type 1 diabetes need to have their blood sugars checked a number of times a day, and need to either take multiple injections of insulin or wear an insulin pump. And there have to be decisions made all day long, because none of these ways of giving insulin also tell you exactly how much insulin must be given. So the parents have to make those decisions, and gradually as the children get older, they learn how to make them themselves.
Wow. I do know one of my sons, my younger son, has a friend who has type 1 diabetes, and it's a big deal. The daycare has to test them all the time and make those decisions, and as a parent, I'm sure it can be very stressful.
It is. It's possible to manage, but it's a lot of work. It really is.
So first and foremost, prevention if we can, if they already have it. Good places that we can direct people for more information.
Okay, on the internet, the American Diabetes Association, the Juvenile Diabetes Research Foundation, and there's a wonderful website called Children with Diabetes. I think it's childrenwithdiabetes.com, which has very good information and a nice chat line. That's a good place too.
Excellent. I know how important this issue is all around, and I really appreciate you sharing this with our viewers. Thanks for being here today.
Thank you.
Please be sure to check out our website, which is mom-matters.com. There you'll find information about previous shows as well as information on our upcoming shows. I want to thank you for joining us today. I'm Alyssa Dver, host for Mom Matters, where we're giving you practical tips for more productive parenting.